So what we knew at the time, remember that this is 20 years of research that's going on here, so was that the treatment offered within CAM services are limited. And I have to say, in a lot of paediatric services, because ADHD can be managed either within paediatrics or within child and adolescent mental health services, and that some of the treatments were limited because we didn't know what worked particularly well with them. What we did know was that the earlier you seem to highlight the difficulties, that this is a child developing an attentional problem, that the better the parents seem to be able to work with. So in other words, if you have a child with ADHD and symptoms, that's not the diagnosis, so this is symptoms at the age of 3, it doesn't go away unless it's mediated for. They will still have it at 7 or 8. And all the epidemiological studies seem to show this, longitudinal studies. What we also found was that parents had similar difficulties themselves. There's a high heritability in ADHD. It's something between 70 and 90%. So if you have a child with ADHD, the chances are you might have a parent with ADHD. That means they're going to have problems with organisation, with paying attention, with listening to you, with remembering what you've told them. So all of that needs to be taken into account when you're actually working with the parent with ADHD. And that parents wanted help, and they were saying, actually, I struggled. I don't want my child to go through the same thing as I did. And at the same time, we started to have more awareness of the neuropsychological deficits that are seen in children with ADHD. For example, working memory. A working memory deficit means that you don't hold in mind the information that you've just been given. So we know that children with ADHD have difficulties with working memory. We know that they have problem with executive functioning, which is the organisation, the planning, the sequencing of time. They don't understand the passage of time very well. So when you're saying to them, get ready in the morning, we're in a time limit, they don't understand that. In addition to that, you have things where some children with ADHD, well, they have something called delay aversion. So they have difficulty in waiting for anything. So they're constantly on at you saying, can I have that, can I have this, can I have that, when am I doing, when are we going, how are we going, what are we doing? More so than other children, okay? Now what you've got to remember is ADHD in itself is it's a dimensional disorder. So it's what we call it's not something that you have or you don't have. It's that we all have some parts of it, don't we? Our attention varies, and we can only give so much attention at a certain time to certain topics. How long are you going to cope with actually listening to me will be an interesting one. But so it varies through time, but when it becomes a problem is when it's impairing. And I think that's always what you've got to remember with ADHD. You can be very hyperactive and a sports person and actually sail through college and have no problems. That isn't ADHD because it's not impairing you. You're actually living, enjoying your hyperactivity and managing it well. So the complexity of the disorder became more apparent. We knew a bit more about it, and we started to unpick this within the psychological literature. So the principles behind the program itself, it's not just a parenting program. What we call this is a parent-led intervention. Okay, so what we do is teach the parents in order to help them help their child with ADHD. And the idea is that you provide them with a toolkit of ideas that they can try. No child that I've ever seen with ADHD is the same as another child. There are similarities, but they're all unique and wonderful in their own way, albeit challenging. So what you do is you give the parents a toolkit of things that they can use in order to help their specific child with the difficulties that their child has. So first off, what we would do is teach them to what we call it scaffolding. It's from the term from Vygotsky, who is a psychologist. I often say to parents, take a helicopter view. What I want you to do is to view your child as somebody who has only just met them, and what you think their strengths are and what you think their difficulties are. And then you break down those difficulties in order to help them build up to become a strength, okay? And remember that you need repetition, consistency over time in order to do that. Now there's 5 themes within the program which work roughly with most of the theories that we work with in child and adolescent mental health. So, for example, psychoeducation is a biological theory. It's about explaining about what's happening within the brain. It's actually saying that we know that there's a genetic component to this. We know that it can be modified by environmental influences as well. And so this is why we're putting forward the program for you to help your child. So you help the parents to understand what's happening within the child's brain, so that's causing them to having problems with their attention.